If you have got a swelling in the thyroid gland, the first question you'll be asking yourself, is it a cancer? So this presentation is to find out, is it to make it easy about all these tumors which are seen in the thyroid gland. First of all, let me explain to you what are these swellings. Survival is the most important purpose of the human body, and for survival there will be continuous cell division and repair and healing. Any injury for that matter, maybe a physical injury, maybe a chemical injury in the form of various toxins in the air, food and other things, and also the mental injuries will cause a lot of problem in the human body, and the cells start dividing continuously. The continuous division of the cells will result in the form of small tumors in the thyroid gland. When you see the tumors in the thyroid gland, which are called as a goiter or which are also called as nodules in the thyroid gland, we need to differentiate two things, whether these are dangerous or non-dangerous. Dangerous swellings will extend beyond the thyroid gland. They will spread in the thyroid gland first of all, then they also go to the other parts of the human body like the brain, lungs, liver and bones, which is called as a metastasis. So when it is spreads to the different parts of the human body, then it is called a malignant tumor with the metastasis. Now, how to identify whether whether these particular swellings are dangerous or non-dangerous? As a radiologist doing these scans for more than 100 patients per month over a period of 25 years, I would like to say the latest imaging methodologies as well as artificial intelligence driven methodologies will identify whether these tumors or the swellings are well defined or dangerous or non-dangerous. First of all, the non-dangerous tumors will be contained within a wall which is called a capsule. This is a defense mechanism of the human body to see that these swellings or these cancerous cells will not extend into the other parts of the human body. So first of all, we will do what is called as high resolution ultrasound and find out whether this particular nodule has got a capsule or not. The other three important features of these dangerous tumors are: number one, they will have increased vascularity. That means they will have increased blood vessels because they are multiplying rapidly without any control of the human body. So they derive most of the blood which is pumped by the heart. So they will take up more blood. Number two, they will have increased cellularity. That means the number of cells in per gram, which will be much more than in a benign or a non-dangerous cell. The third thing which is important is these cells will be multiplying very fast and they will be doubling in size within no time. So vascularity and the cellular density and also the multiplication time or the doubling time is very high in dangerous tumors. So AI based imaging, especially high resolution ultrasound and magnetic resonance imaging, will tell us whether it has got dangerous characteristics or not. Now let me tell you the first thing what I would tell you is the moment you see a swelling, the first thing they will tell you whether we can go for a biopsy and take a piece of tissue. Biopsy is sticking a sharp needle into the particular tumor and taking a small piece of tissue and examining under the microscope whether it is malignant or not. But in this situation, what you'll be doing, you'll be breaking the capsule or breaking the wall of the particular tissue and making the cells to, enhancing the cells to spread to the adjacent organ as well as the different parts of the body. So the biopsy should be limited as much as possible, and this imaging of dangerous or non-dangerous cells should be done by imaging studies which are artificial intelligence based and which will help you to identify. So once you identify these cells, we categorize these cells into what is called as TIRADS, or also what is called as good tumor, bad tumor or ugly tumor. Once you do an ultrasound, you can say it has got a well-defined capsule. That means it is a good tumor. You can just ignore that. And if you also do other tests like vascularity, cellularity, and say if it is a bad tumor, then you have to follow up in frequent intervals, maybe at the end of 3 months or at the end of 6 months, depending on the severity of the tumor. If it is doubling very fast, then you may have to do a biopsy and take it out as early as possible. There are ugly tumors which are already extended beyond the capsule, which can be seen very well in ultrasound, that should be removed immediately. So friends, classify these swellings. The radiologist will classify these swellings into a bad, good, bad and ugly. Good tumors, you wait for some time or you do not do anything. Bad tumors, you follow it up over a period of time and see whether it is increasing in size or not. And ugly tumors, you remove it very immediately. Finally, we should know what are the causes for these tumors. It is not only the physical injury, the chemical injury. The most important injury is the psychological injuries. Stress, strain, anxiety will cause the tumors to increase in size. So you have to work, you have to enjoy your work, you have to live with the love and affection, respect everybody. Then in that case, these tumors will remain dormant forever and ever. Thank you very much.